Thank you for being here with me. My name is Dr. Tina, and I'm here to educate you about a topic that has been bothering many people, and this is diabetes. Diabetes has been one of the illnesses that affects a huge number of people everywhere, among the old, the young, the rich, and the poor. But the deadly aspect is that the complications that are caused by diabetes. This is so serious that I deem it necessary to educate each and every one out there about diabetes. So take your seat whilst we dig in. So diabetes, what at all is diabetes? So as human, we all eat. And when we eat, this food turns to energy to give us the strength to go about our daily activities. However, according to CDC, diabetes is a chronic illness that affects this process. Remember when we were young, they said food is fuel. So food in its sense gives us the energy, the strength, so that we can do our daily activities without any problems. But when one develops diabetes, this process is interrupted. When we eat, the type of food that we eat turns into sugar in our bloodstream, also known as glucose. When this sugar goes high or increases in our bloodstream, our pancreas release or produces insulin, which then helps to turn this sugar into energy for us. But sometimes our pancreas production is not adequate, or the insulin that we have is not adequate to do the job, because as time goes on, this sugar in our bloodstream keeps on increasing, which makes it hard for our cells to even use it. And so what it is that sometimes we are not able to produce adequate insulin to help convert our food that we eat into the required energy that we need. As time goes on, one develops diabetes. So we have three types of diabetes. We have type 1, we have type 2, and gestational diabetes. What is type 1? So type 1 diabetes do affect mostly young folks, children, teens, adults, young adults, and even sometimes adults can also have that. And what causes one to have this diabetes, type 1? So we call something autoimmune condition. So if your body begins to attack your own body, that is autoimmune. And it's so hard to control it because it's your body fighting against you. And so most people who are diagnosed with this ailment is mostly young folks. So teens or young adults can also have this illness. Type 2. Type 2 diabetes is one that affects most number of people. As a matter of fact, if you take 10 people in America, one person is diabetic. That shows how serious and how common diabetes is. The problem is that diabetes does affect most of our health. It does affect most of our organs, and that it makes it critical. So type 2 diabetes affects people that are older, let's say 45 going, are easily diabetic. Or if your family member, brother, sister, parent have it, definitely you could have it. But mostly, we can have diabetes without even our family or hereditary. We can have it because of our lifestyle that we live. So what it is that as our pancreas help produce insulin so that the sugar in our body can convert peacefully to energy. Sometimes we have so much sugar in our body, in our bloodstream, that the cells are poisoned. And even insulin that produces cannot convert it to energy anymore. Sometimes we are not even able to produce adequately to help convert our food that we eat to energy. And that causes a whole harm to our heart and even kidneys. So diabetes is very critical to discuss. The third type is gestational. Gestational occurs when you have no diabetes. One does not even have it, but they then are diagnosed with it when they get pregnant. So let's say I am a woman, right? But I don't have diabetes. And when I get pregnant, I'm diagnosed with diabetes because my child may be too big, which put the child even at risk that At the end, if you don't take care or control it, when the child comes out, he or she might have issues or illnesses. This one, when the patient or the person who is pregnant deliver the baby, they are able, then they are free from the diabetes. But this increases their risk to be diagnosed with type 2 or something in the future. So we admonish that when you are you have the gestational diabetes, we encourage you to continue to be careful the way you eat and everything, so that it won't put you at risk to have diabetes after delivery of the baby. So these are the 3 types of diabetes. Type 1, that is insulin dependence, because they will have to rely on insulin throughout their lives. And type 2 diabetes, which is diabetes mellitus, and this usually affects grown-ups, older adults, or from 45 going. And then we have gestational, which it tends to affect women, because women are the only one that go through the gestational period, and that when they are pregnant, they have it. So those are the types. Diabetes risk factors. What are some of the things that causes one to have diabetes? When we take type 1 diabetes, it is caused by family line. So let's say your parents, your brothers and sisters have it, then you have the probability of having it. Also age, it does affect it. Even though it affects young folks, teens, and even young adults, it sometimes can affect any age for that matter. So those are the risk factors for type 1 diabetes, which is insulin-dependent diabetes or diabetes insipidus. Type 2 diabetes. So type 2 risk factors include age. So let's say from 45 going, one is at risk of having diabetes. Lifestyle, the way we eat affects us. Not being physically active, let's say not exercising 3 times a week, can also put one at risk for that. It can also be hereditary, where family members have it and then you have it as well. But mostly lifestyle is the most effective aspect of it all. If you are not active and not eating properly, then it puts you highly at risk for that. Gestational diabetes also, which is the 3rd type, one is at risk for it when you are overweight, or the child that you are bearing is going to be, let's say, over 9 pounds. And also the way you eat too, that is affected, and your age as well, like 45 and upwards. So these are the risk factors that puts one at risk. But you see, what runs through is your lifestyle is very important, and that is serious, and we must take it seriously. I will also use this opportunity to educate us about prediabetes. Many people are being diagnosed as prediabetes, which put them high at risk to be a diabetic. So when you are told that you have diabetes or prediabetic, then you must take every necessary precautions to prevent you from getting diabetes itself. So diabetes or prediabetes, according to CDC, 88 million adults in America are diagnosed as prediabetes. That is, when you take 3 people, one person is pre-diabetic, which puts them at high risk of being diagnosed with diabetes in the future. So we must take good care of ourselves, especially if you are cautioned that you have diabetes pre-diabetic. When you are pre-diabetic, you must take good care of yourself. So diabetes symptoms. I'm going to read something about diabetes symptoms so that I won't miss any symptoms at all. And so I have my backup here, and I'm reading from CDC. So if you want more information, you can go to CDC. So what are the symptoms? What shows that one have diabetes? So most of the times, you have a patient complain that I urinate a lot or pee a lot. That is a caution that this patient might be having diabetes, because peeing a lot is one of the symptoms. So whenever you are there and you feel like you are peeing abnormally, more than necessary or more than the way you used to be, then you have to let your healthcare provider know, and so that they can test you and treat you accordingly. Very thirsty. Some people say, I feel so thirsty. I drink a lot. No matter how much I drink, I still feel thirsty. That is something that should caution you that something is not right. Because I have seen a lot of patients that they said whenever they go to their doctors, they tell them they have been urinating a lot, especially male, urinating a lot and drinking a lot, but their providers focused on a different aspect because they are male. What am I talking about? What I mean is they be thinking of prostate prostate cancer or something, and so they missed it. And so we have had male patients that have come to the ER with high glucose and seriously cause them to faint or collapse or have some aspects of um, complications because of that. So if you are there and you are drinking a lot, peeing a lot, and you go to your doctor, you can alert them that they should check you for diabetes as well, since it tends to cause a lot of problems. So you don't want to wait. You don't want to wait till it gets bad. The other symptoms is losing weight. When you are there and you begin to lose weight, then is a caution that something might not be right. And so they can also, your provider, you can seek help, and your provider can also test your A1C to see if you have diabetes. So drinking a lot, peeing a lot, losing weight unnecessarily, not that you are on diet or exercising or you are in a certain kind of procedure or something, but you are there and you are losing weight, then that should be serve as a flag or a red flag for you to get diabetes check. Very hungry. So despite the amount you eat, amount of food you eat, you still feel hungry. It's also another signs and symptoms. Blur vision. So you begin to have blurry vision, and that is very critical because diabetes tends to affect our eyes, and most people lose their eyesight. And so if you are there and you begin to have this blur vision and having all other symptoms, then it should alert you that you need to talk to your doctor so that they can help test you for diabetes. Numbness and tingling of our hands and feet. So most patients do have this, especially if they have had diabetes for that long without even knowing. They begin to have tingling. They begin to have tinglings in their fingers and also their foot. And so be careful if you start to have these symptoms. Let your doctor aware, and then they can help you and test you for diabetes to prevent any further complications. Feel very tired. So sometimes you feel so tired. You are like, I don't know, I feel so tired. That's what people say. I feel so tired. I feel so weak. Then that should caution you that you should talk to your doctor about that. Very dry skin. A lot of people have dry skin. And so when you are diabetic, you tend to have dry skin. And if you have all these symptoms and begin to have dry skin, then I caution you to consult your doctor so that they will do something about it. Have sores that heal slowly. Did I say that? When you have sores that do not heal or heal slowly, you will have a wound going on, and this wound will never heal. That's a caution that you might be having diabetes. And also more infections. You tend to have more infections, especially UTI. You tend to have that, then that is also a caution. So these are general symptoms that one should look out for when you have any of these symptoms. Let your doctors know. For type 1 diabetes, if one tends to have type 1 diabetes, some of the symptoms they show will be maybe nausea, vomiting, stomach pains, and so they tend to lose weight when you have this diabetes insipidus or type 1 diabetes, and that we should be careful. We should seek help immediately. Type 2 diabetes, it doesn't just come out like once. It takes a whole long time for one to be diabetic, so it will be lingering in your body for that long period of time. So before you are even diagnosed with diabetes, that means you have it for a long period of time. As type 2 diabetes, and some of these symptoms that we listed as general one, it does affect them in peeing a lot, thirsty, weaknesses, those kind of stuff, those that affect type 2. Gestational diabetes symptoms. So maybe between 24 and 28 weeks of pregnancy, your doctors will test you for that, and that they will tell you if you are gestational diabetes or not, and that's how one is found out. So the signs and symptoms of diabetes is having all these that I've listed over. So how do we test for diabetes, or how is one test or diagnosed with diabetes. So the number one test is hemoglobin A1C. So when you visit your doctor, they will draw your blood and then send it to the lab for them to run it out, and there will be a number that will tell them that you have diabetes or not. And there are other tests too: fasting blood sugar tests, we have glucose tolerance tests, we have random blood sugar tests, and then we have tests for gestational diabetes, where you go, like I said, between 24 and 28 weeks, they test you for that, and then glucose screening tests. So there are multiple of tests that can be performed. So your doctors can perform maybe two of these tests to confirm that you have diabetes, but mostly we do test hemoglobin A1C, because that shows that you've been a diabetic for that long period of time. And so those are the tests. So most people are concerned that when and how is one diagnosed as a diabetic. So let's say if your hemoglobin A1C is tested, these are how the numbers are arranged. So anywhere below 5.7, you are not diabetic. So if you fall below 5.7, you are not diabetic. But from 5.7, before you hit 6.5, you are pre-diabetic. So from 6.5 going, then you are really a diabetic patient. And that one, we put you on medications. But when you are pre-diabetic, you can use lifestyle management to control it. Okay, so what are some of the ways you can do to prevent you from getting diabetes? Number one is your lifestyle changes. And so the way you eat got to change. You need to eat more vegetables. Avoid food containing high sugar content and also a lot of carbohydrates. Try to exercise at least 3 times a week. And if it's very difficult, you can join some groups for lifestyle. You can join them. They will show you how to eat. You can work with your nutritionist and they can guide you on how to eat, so prevent you from getting diabetes. And also, if you are diagnosed with pre-diabetes, you can delay it or you can prevent it by adapting these rules, by eating properly, exercising, losing some amount of weight, and that can help you to prevent diabetes or prevent you from being diagnosed diabetic. However, if you are already diagnosed with diabetes, there are certain things I will urge you to do. That is, following the education of your provider. Make sure that everything they tell you, you educate yourself about this. So mostly diabetes is managed by you. You are the only one that can prevent diabetes or reduce complications of it if you already have it. The first thing starts with you, that is management, self-management or self-care management, and that's you. You have to accept it that you have that and that you are going to do everything possible to educate yourself about it. Second, eat well. You make sure that whatever food you put in your mouth, you reason before taking that food into your mouth. Because high containing carbohydrates that you eat is the same one that would turn into sugar in your body, and you don't have enough insulin or strong enough to fight or convert it to the energy you need, but complicate things. Get active. So you need to work out every 3 times a week. It's okay. So if you have diabetes, you make sure you work out. Healthy weight. Make sure you lose weight, since overweight puts you at risk. It's very important that at least you lose some amounts of weight. Manage your blood sugar. Always check your blood sugar to see how much it is. And so let's say before you take your medication or anything, you check it. After you have taken the medication a while too, you have to check it to see how your numbers are doing. And every 3 months you have to see your doctor so that they will follow up to do the hemoglobin A1C to see how you are doing with your diabetes. And also prevent diabetes complications. You don't want to end up on dialysis. You don't want to have complications with cardiac issues. And so you need to stay on top of things to prevent other complications like end-stage kidney disease. Managing sick days is very important, that whenever you are sick, your blood sugar tends to increase. And so when you are sick, you have to know how to manage it. So you have to consult your doctors when you are sick, and they will be able to direct you on that. Taking your medications as prescribed is very important. At first, they will start you with metformin, which is the preferable treatment. And so as time goes on, if it's not able to control, then they will put you on other stuff. But you can use oral medication to control it. If you are able to control it well, then you won't end up on insulin insulin, because trust me, if you end up on insulin, it's very hard to take you off that. And also it puts you, it makes you gain weight. And so it's very important that you take your oral medications appropriately as prescribed for you. This is the longest video I've ever made, but I think it's very important and necessary for you to know about diabetes, type of diabetes, how to prevent it, and the tests involved, and what are things you can do when you are already a diabetic. I hope this helps. Remember to check your feet all the time, because diabetics tend to have problems with their feet. If you have any cuts, you have to seek for help immediately, because a lot of people have lost their feet, their legs, their limbs because of diabetes, and you don't want to get there. I hope this education helps. Again, this is Dr. Tina. Please go ahead and subscribe to my channel, as I'm ready to present to you a lot of diagnoses and ways to prevent them. Thank you. You have a blessed day. Bye.